Thank you, Julie, and good afternoon, everyone, and welcome to this session. It's great to have you be a part of this, and we're looking forward to our guest leading this session. Amanda Benton, it comes to us from the Office of the Assistant Secretary for Planning and Evaluation in the Department of Health and Human Services. We refer to that office as ASPE. And she is an ASPE team lead senior social science analyst and has led their social capital work. She also coordinates some agency policy work, manages research contracts, and conducts qualitative research on a variety of topics. Amanda has become somewhat of an expert on social policy, and we're really excited to have her be a part of our presenting team. So I'm going to turn it over to you, Amanda.
Great. Thank you so much, Jerry. And thank you all for having me. So as Jerry said, I work in ASPE, which is kind of the policy and research office for the Department of Health and Human Services, meaning we focus across the department. So we work with FISB, but we also work with the Substance Abuse and Mental Health Services Administration and Centers for Medicare and Medicaid Services, and sort of across the department. And so we get to focus on populations and issues rather than specific programs. And social capital is one of those issues that we have really dug into over the last couple of years. The general idea behind social capital is that relationships matter. And research shows that people with high levels of social capital are happier, they're healthier, they find better jobs, they live longer. So today I'm just going to share some of our research findings on strategies to help youth and others build and use social capital. And I am hoping to hear during Q&A and also in the chat kind of throughout as we go, how this resonates with your own programs and communities. So please type questions into the chat as we go, share your thoughts. I really look forward to sort of doing that. Okay, next slide. What is social capital? Next slide. Julie, can you go ahead and launch poll number 1? So we want to go ahead and ask if you just use the term social capital in your work. Is that part of your program? Is that sort of a way that you and your colleagues think about and talk about the work that you all do? Just a sort of a simple yes or no. No right or wrong answer. Just curious if that's a term that's being used right now. Okay, so it looks like about 84% of you said no, you do not use social capital. You might have to close out of the poll box on your screen, but next slide. 84% does not surprise me. Honestly, a lot of folks do not use the that term, social capital, and I'll get into that a little bit more, but I suspect it's something that all of you are doing. I think social capital is probably a really important part of all the programs that you do, and your focus on healthy relationships. But social capital is kind of an academic term, so I hope to sort of explain a little bit about what it is and how we've been using it. So my office has come up with this sort of working definition of social capital. And the idea is that social capital is not just relationships, but those are important in and of themselves. But it's the idea that relationships produce something of value. That could be tangible, that could be intangible. So it could be a ride to school. It could be emergency childcare. It could be a job referral. It could be emotional support. That there's something sort of a value coming from that relationship. We think about 3 different types of social capital. Though sometimes the lines between them can be a little bit blurry in practice. We can have building social capital, which is with someone of a similar background or experience. So, for example, one low-income adolescent to another low-income adolescent. We think about bridging social capital with someone from a different background or experience. So that could be like a low-income adolescent to a higher-income adolescent, or maybe to an older adult. And then we also think about linking social capital to people or institutions with power in the community. That could be hospitals or employers or school superintendents, that kind of thing. Next slide. We do think about social capital strategies very broadly. So the work and community engagement that you all do to build relationships, family strengthening, connections to faith-based groups, peer-to-peer supports, mentoring, a lot of these things really can count as social capital building activities. Next slide. Julie, will you pull up poll number 2? I just want to kind of get a quick temperature check to kind of have a sense of who's sort of in the virtual room, so to speak. are any of your programs sort of currently helping youth build or access social connections and resources through things like through mentoring or peer-to-peer support? Or if you're using some other strategy, feel free to just go ahead and put that in the chat box. And these are two of the strategies that we have found to be most common, but there are a lot of different strategies, and I'll walk through those in more detail as we go. But it's good to see. I'm seeing sort of a mix of people using mentoring and peer-to-peer supports, which is really great already, and other folks using other strategies as well. I suspect many of you are quite expert in this, and so you can teach us all a little bit as we sort of get into discussion, and particularly during the field talk as well. Okay, so yeah, it looks like I'm seeing 43% of folks are using mentoring in their programs, about 37% are using peer-to-peer supports, and another 20% are using other types of social capital building strategies, which is great. Thank you. Okay, next slide. So there's a lot of research on social capital. It's very big in academic literature, and I just want to kind of pull out a few pieces around economic mobility and well-being. Right, long term, we're trying to help adolescents get on the success sequence, sort of set up successful career trajectories and the like. So as we think about employment, for example, we can also talk about the quality of relationships, strong or weak relationships. And what we found is that strong, likely bonding social capital with sort of other low-income individuals is what low-income folks most actually often tap into and sort of in reality to find jobs. But the bridging ties might be a little bit weaker to sort of higher status individuals, for example, but those can be important for getting better jobs. So that's something to think about why you might want both. I also want to talk briefly about research on peer support. So we think about three types of peer supports. Peer mentors who have a shared experience. They've also kind of gone through the programming, for example. Peer navigators who act as case managers. They might help with systems navigation. They might be paid or have special training. They kind of have a more formal role. And then peer support groups. So there's some research on peer mentors in healthcare and education to find benefits. So for example, in undergraduate education and community college, having a peer mentor is associated with better academic outcomes, like staying in school and getting good grades. And in other areas, we generally find that their research is less rigorous, but both staff and participants really value these peer mentors. We can also think about these peer navigators, kind of the more formal systems navigation folks. And there's been some research in healthcare that's found that it can improve treatment outcomes for folks. And then peer support groups, we know from fatherhood programs and some other areas that these types of support groups can really have some positive effects on some things. And again, that both program staff and program participants really generally have good views and appreciate these support groups, letting youth, for example, share their experiences and their struggles, meet positive role models, offer and receive advice and support from their peers, and really develop relationship skills. Next slide. So today I'm mostly going to talk about some findings from a study we did. We worked with RTI and the University of North Carolina School of Government to scan human services programs generally that were interested in intentionally helping participants build and use social capital. We included programs for youth, but we did also include programs for adults. We started at about, I think, over 300 programs and narrowed it down to just over 30 where we had more detail and they seemed to have a pretty strong component. We found a couple of things. First, as with you all, most programs do not use the term social capital, right? That's kind of an academic term. It's a nice framework, but it's not necessarily how we talk, right? We think about community, we think about support, we think about relationships. Those are sort of much more commonly used terms. And for programs serving young adults, right, we might think about healthy relationships, permanent or positive connections with caring adults, those kinds of things. As with you all, mentoring and peer supports are among the most common strategies that it seems like programs are using. And we found that while some organizations really their whole sort of intervention is based around social capital, for most, sort of social capital component is one part of several aspects of their intervention. So our working theory here is sort of if your underlying program is effective, then if you're really intentional about social capital, you can kind of amp up its impact. But you can't just tack on a social capital strategy as an afterthought. It should really be central to how sort of you think about your theory of change. And I do just want to flag with all of this, the evidence base is still very much developing. There's been a few rigorous evaluations, but not very many. So I do want to talk about measurement next, because there is a lot that can be done and is already being done. But we've got a long way to go. Great. Okay, next slide. So we've also done some research thinking about how to measure social capital. Basically, if we think it's important, then we should try and measure it to understand what kind of role it plays. So we talked to a bunch of different HHS program offices, including FISB. We also talked to local programs on the ground to see how they're measuring social capital, just to see what data is out there, how people think about this. And after talking with all these folks, we can say there is no one single common best way to measure all the different aspects of social capital. But there are lots of ways that that's already being done, including some that are somewhat common. So we can measure access to resources in times of need. For example, by asking youth if they have someone to turn to for a ride to school or if they need a small amount of money in an emergency. We can ask people if they have someone in their lives who they deeply trust. So I think I was just saying there's different ways that we have found that folks are very commonly measuring social capital. And so for example, running in homeless youth programs or some other programs, we might think about questions like the one on the screen, right? Are there responsible adults or mentors who pay attention to what's going on in your life? That's kind of a set of questions that is often asked in certain types of programs. When, like RHY programs, for example, running homeless youth programs, they're measuring permanent connections with supportive adults. All right, next slide. So we can also think as we're measuring about some of the key pieces. So we tend to think about social capital as a positive thing, but of course it can also be negative, right? It could reinforce existing social networks and exclusion. The classic example here is gang membership, and we need to sort of help people get out of unhealthy relationships and into healthy relationships, then we want to be able to do that. So we of course want to focus on positive social capital. We also want to think about what the community is like, what the participants are, because in different contexts, different types of program, we might want to measure different things and sort of understand and make different decisions about how we do measuring. I think central to all of this as you're measuring social capital is understanding your goals. Are you trying to measure a youth growth in social capital over the course of your program? Are we trying to compare their social capital levels to people who are in the program to adolescents who are not in the program? Are we trying to see if youth who have higher levels of social capital end up with better program outcomes? Trying to really understand what it is that our goals are, I think, is really important. And also unintended consequences are very critical as well. So there was one program that we talked to really said that they had encouraged their case managers to start documenting the efforts they did to help participants build connections with people in the community. And what ended up happening, unfortunately, was that the case managers focused so much on making sure the paperwork was right, that they had everything written down, that they were spending less time helping with the actual sort of relationship building. And so those relationships and that social capital actually suffered. So we really want to be careful about those as well. Next slide. I think we're going to skip that and go to the next slide. And then I just want to flag that we have a logic model tool, and I'll provide a link at the end, but something you can sort of take and tailor to your program and really think about, what are the inputs? Youth and adolescents themselves, for example, bring a lot of resources to the table. What are those sort of coming into your program? As we're thinking about sort of the social capital flow, what are some of the activities your program does, like peer mentoring or peer-to-peer supports or mentoring that help sort of build social capital and help adolescents tap into that? And then what are the outputs and the outcomes that come from that? Next slide. Okay, so I want to use the rest of my time to focus primarily on these emerging practices for building social capital to help participants do that. We call them emerging because they're really based on this qualitative work, so we don't think the sort of level of rigor is quite strong enough to call them best practices or promising practices, but we do think there's a lot of promise there. Next slide. So before we do that, I want to just say that when we were trying to identify these emerging practices across the 30 programs that we looked at, we found there's a lot of programs, there's some sort of underlying principles that many of these programs seem to follow, regardless of which specific social capital building practices they have. So I'm guessing a lot of these will feel really familiar to you and sort of feel natural in many cases. I'm sure many of you are already doing many, if not all of these. A lot of these programs are person-centered. They view youth as the experts. Youth might drive the goals of the services of the organization. Youth kind of drive that process and feel respected. The idea is that then trusting relationships are more likely to develop. Programs also view relationships as assets. So social capital is just as critical as, say, a bank account or a building. Many of these programs see staff and participants as partners. They're attentive to the power dynamic and really make sure that staff and youth see each other as equals. Also, of course, the importance of cultural competence and being aware that staff and youth might come from different backgrounds, and so being really open to different cultural perspectives and working together. And then emotional intelligence. A lot of programs have staff that really are able to properly navigate their emotions and those of others. Next slide. Okay, so this is the fun part and sort of the meat of what I want to talk about today. By talking to these 30 programs, we did some case studies, we talked to experts, we did sort of a bunch, and we identified 8 emerging practices that a lot of programs use to help youth and others build and use social capital. Not every organization needs to use all of these. There are definitely other strategies out there that are being used to help youth build and use social capital, but these were the ones that sort of rose to the top that we heard about the most. So the first is the idea of using cohort models. So we want to think about the group cohort. Ideally, it'd be pretty small, so to allow relationships to flourish. You want youth or others who have enough in common or know each other well enough that they can trust each other, that they are willing to hold each other accountable, but also that they bring different networks and perspectives so they can learn from each other. For example, sometimes having one person who's already had some success can actually inspire others that it's possible. We also want to think about the value of accountability. That was one of the most often mentioned benefits by participants in the programs we spoke to. They like the accountability that comes with cohort models, accountability for themselves. Having a peer who's someone that they trust and who will make sure they're showing up, that they're working toward their own goals. Someone they've built enough trust with that really they can call out their peers when they veer off course in sort of a very supportive and helpful way, that relationship dynamic and that accountability can be really critical. For cohorts, we also want to think about the facilitator. Being a facilitator, as I'm sure many of you know, is really specialized skills, especially to be a peer group facilitator. That's not the same thing as being good at one-on-one relationships. You have to know when to lead the discussion and when to be quiet and let the peers talk amongst themselves. You have to know when to redirect the conversation if inaccurate information or off-topic information comes up. As much as possible, it seems like it's important for facilitators to be relatable, someone with a similar background and experience as peers. So peers themselves can actually be very effective peer group facilitators. Participants often find it's easier to connect and relate with someone who has gone through what they're going through and kind of gets it, and maybe even could give them some hope that success is possible. One other thing to think about is whether it might be appropriate to help youth set their own rules if you're using kind of a peer cohort model for your adolescents, where the youth are setting the rules and the structure and the content so that they're really bought in and accountable to the work. A good facilitator can guide youth through that process to develop those in a way that's productive. Next slide. Okay, so another practice that we identified from our research is this idea of building meaningful relationships. Typically, we're talking about long-term relationships. It tends to be that relationships take a long time to build sort of meaningful and depth of connection, but that's not always true. And quality matters much more than sort of quantity or length. And not all programs are appropriate for a long-term relationship. The goal here is really to develop that meaningful relationship. Ideally, even after the sort of formal program ends, there's a long-term connection that continues. So one of my favorite examples of this is ROCA, which is a 4-year program. They've got sites in Massachusetts and Maryland that serves at-risk youth. And the idea is they have this concept called relentless engagement. And what it is that they just keep showing up for youth. Even if the youth doesn't seem engaged at first, they just sort of show up over and over and over and over again and prove that they're there for the long haul, that they are in it with the young person, that they care about them and are there to help that person meet their goals. And so that really can help build these deep, lasting relationships. Next slide. So we can also think about social capital at different levels. I've been talking mostly about individual level social capital, kind of person to person, one-on-one. But we can also think about social capital at an organizational level. That might be something like partnerships and kind of networking among organizations. And then we can also think of it at the community level, things like civic engagement and the strength of the faith-based or nonprofit sector. And I will be honest, I originally thought of those three things as completely separate, but they, of course, all affect each other very much. So, your relationships as a service provider at the organizational level with businesses, with faith-based groups, with nonprofits, those are all really critical. And the stronger your organization's social capital, the easier it is for youth to tap into that. So just to kind of get concrete there, your provider relationships at organizational level make it easier for individuals within your organization and within your partner organizations to sort of be more likely to trust each other quickly to help build that personal connection. And so that helps with youth too. So just to sort of give an example, I think law enforcement can be kind of intimidating for some of our youth and adolescents. But if your agency has a strong relationship with them, you could sort of bring together youth and law enforcement together in a safe environment and build those connections, those one-on-one conversations. That can really smooth the process and some of the fears of youth in connecting with them, sort of understanding and having some open and honest conversations. We also want to think about, there's a lot of cool strategies that some of the programs we studied use, including making sure you're giving people the name and number for a specific person within another organization rather than just a general number. So for example, if you're referring an adolescent to the Youth Workforce Board, instead of just saying, here's the general number, good luck, you say, here's the number for my friend Joe at the Youth Workforce Board. Or even, hey, do you have a few minutes? Let's sit down and call Joe together, and I'll introduce you to him. And sort of building that personal connection and helping folks navigate that. One thing I do want to flag is that organizational connections alone are not enough to build individual level social capital for youth, right? We need to think about how to strategically leverage those organizational connections to help youth build their own connections. But there are a lot of organizations, and I'm sure many of you as well, that are just not shy about tapping into the friends, the family, sort of the coworkers, anyone of their staff, of their volunteers, of their board of directors, kind of anyone associated with the organization. All of those folks can bring just a ton of tangible and intangible resources to bear. So it can be really exciting to sort of think about who your organizational network of partners are and who they partner with and who what resources all those folks can tap into. Next slide. So another of the practices that we identified is the idea of using technology, things like apps and social media to support data collection and program management to really help build individual social capital. So a couple examples of this that I really like. One is the MOMS program, which is in New Haven. It serves women who mostly have severe depression. They've got low incomes. I think they read at like an average of 5th grade level, but there's an app for these program participants. And with their consent, the app tracks when the moms get together to support each other, sort of uses GPS to track when the moms are physically together. Obviously that works a little bit better in non-COVID times, but to sort of when they're physically getting together and networking and connecting. The app also incentivizes social connections and activities like getting a library card. I think that gives you tokens, and then you can sort of exchange those tokens for gift cards or coupons. So sort of using that creatively to get data collection and sort of understand what's happening. The other example I really like The Family Independence Initiative, which is an organization with some locations across the country, uses online journaling for its participants, and it asks them to set some goals and answer a bunch of questions, at least on a monthly basis. They log in and sort of update their information. But one of the things they're asked to do is to quantify the help given and the help received. So this is something like, let's say your neighbor has an emergency, they need childcare, they don't have a chance to find somebody, and you offer to do babysitting for 2 hours, so you do it for free. And the going rate for babysitting in your community is, I have no idea, $10 an hour. So you've given $20 worth of help. And so they ask participants to sort of think back over the last month, what kind of help have you given and how much help have you received in kind of a dollar value amount? And what they found is that this really is very empowering for participants, and it helps them realize that they've already have a ton of access to social capital, a ton of resources, and that they bring to bear a lot, that they sort of are already tapping into and sharing a lot of resources and strengths. And so that can be a really, just a big moment and sort of an eye-opening moment for participants to realize how much strength and social capital they already have on the table. Okay, next slide. And Julie, will you pull up poll number 4? So I just want to pause for a moment here because I've been throwing a lot of information at you and kind of see if your organization, do you think your organization is already doing any of those 4 practices that I already walked through? So kind of peer cohort models, engaging with youth meaningfully through time or intensity, using your organizational connections to help individual youth and adolescents build sort of their own social capital, or using technology creatively. I kind of want to get a sense of if folks are already doing some of these things. And I would love to feel free to just put in the chat how you're using these, any of these strategies, sort of what your own lessons learned are in these areas. We can hopefully have a good discussion later as well, but would just love to hear what folks are doing. Okay, so I am seeing a great set of mix here. Looks like about half of you are using cohort models. Over 80% of you are already engaging with your youth meaningfully through time intensity, which is wonderful. About a third of you are using the organizational connections and networking to sort of help youth and adolescents build their own social capital. And then over half of you are using technology as well in creative ways to support these relationship building activities. So that's really great. Really, really great. Thank you. Okay. Next slide. Okay, so that was 4 of the 8 emerging practices. I'm going to walk through the other 4 now. So we talked a little about technology, but I also want to talk about data. And I am in a research office, and it would be remiss of me if I didn't sort of talk about the value of data in helping us sort of understand which social capital approaches lead to the best outcomes. I did mention already that in this area, not that many programs have been rigorously evaluated. And we actually find, because for many of us, many of our programs, as I think for many of yours, it sounds like, social capital is one part of sort of a larger intervention. So even when we've had rigorous evaluation of the whole program, we can't necessarily say that it was the social capital component per se that made all the difference. It's kind of the package of resources and services that we offer that kind of lead to those outcomes. But there's one study that I really want to call out. It's of the Building Wealth and Health Network, which is based in Philadelphia. They serve TANF program participants, and they randomly divided their participants into 3 groups. So one that got standard TANF programming, which was supervised job search and job training. One that also got matched savings accounts and financial empowerment classes of about 3 hours a week for several months, 28 weeks. And then a third group that got, just like the second group, the matched savings accounts and the financial empowerment education. But they also got trauma-informed peer support groups for 4 hours a week. And what they found is, kind of comparing these 3 groups that folks were randomly assigned, that this third group that also got those trauma-informed peer support groups had greater earnings and sort of reduced economic hardship. They had fewer depressive symptoms, and overall they had increased self-efficacy. So we really can see that that value of those peer support groups, when you sort of randomly assign, shows up what the difference is there. And so I think using data and thinking about a way to do that, and kind of going back to the measurement discussion, really thinking about how we're collecting this information, how we're using it, and what it tells us about our program, and sort of which aspects are most important can be really helpful. So there's another practice I want to talk about, and I think it probably will surprise no one on this call that organic natural connections are often much better and much more meaningful and valuable than those that are really forced and contrived. That said, sometimes we as organizations and service providers really have to take some proactive steps that might feel a little bit forced or contrived to create space for those organic connections to build. So we do things like we build cohorts, we provide food and a space to mingle, right? We sort of create the opportunity for people to sort of give people a chance to come together and to build their own natural connections and resonate and connect with individuals. So for example, one program that's a responsible fatherhood grantee that we work with, Connections to Success, hosts these family dinners. And it's sort of for all the families involved in their service programming. They come together, I think it's on a monthly basis, and just come together over dinner. I think, the idea, and again, some of that works better in person than virtually, but there's lots of virtual strategies as well. But really just giving people that space to come together. Having a space where if parents are dropping children off, for example, that's got a space with seating and coffee and sort of a chance for them to get together and network could be really helpful. We also really heard over and over again from the programs we studied about the importance of including former participants in programming and staffing. So alumni really can just bring this huge level of credibility in the eyes of current participants that many of us can never hope to replicate at the same way. Our experts stressed, however, that it's not just any old program alumni that's important. You also need someone, an adolescent who's qualified in other ways. So maybe for whatever the job is, right? So maybe it's someone who's really comfortable engaging folks, or maybe it's someone who has sort of other skills necessary for that job. But bringing someone who's been through the program and kind of understands it and has similar life experiences, and then also has some good skills related to whatever the job is that you're looking at. And then the last practice we identified is this idea of emphasizing accountability. And so some programs really use explicit written or verbal agreements or commitments to foster that accountability. I think a very important clarification here is that these agreements should clarify the relationship. They don't structure it. They don't require what the relationship looks like. That doesn't have to go a certain way. The idea is to set expectations and make sure everyone is on the same page, not to mandate what the relationship looks like. I think it's kind of impossible to mandate a relationship. So Youth Build is a good example of this. They have mentors and mentees complete and sign a written agreement, just so both parties are on the same page about how often they're going to meet, what the expectations are in between meetings, how they'll treat each other. The idea is you can develop these agreements together so that everyone is on the same page. Julie, can you launch poll number 5? So this is a similar question. Going back through that sort of second set of 4 practices, I'm curious what folks are already doing. Are any of you already using data to help build and leverage social capital, or sort of creating the physical space or the time for organic connections to build? Are you including adolescent alumni or SRA alumni in the programming? Or are you thinking about ways to emphasize accountability and sort of structure those relationships? Okay, wrap it up. Good. So it looks like we've got some experience with all of these strategies. The fewest of you are using alumni in your programming and staffing, so I think it could be really valuable to hear from those of you that are already doing that, what that experience is like and what your lessons learned have been. Many of you are also already emphasizing accountability, which is really great. I love to see 65% of you using data to help build social capital. That's amazing. I think it's so hard to use data, but obviously so important. And then really wonderful that so many of you are creating that space and opportunity for those organic connections. It can be hard, but it's really important. So I just want to kind of wrap up a little bit on thinking about where we are in this moment in time during COVID-19 and kind of our current circumstances. I think we would argue that social capital is even more important in times of crisis. youth in COVID-19 quarantine or sort of isolation or just seeing people less might be able to use social capital even more. It could help them, for example, better combat social isolation. If we have friends and family who are calling to check in on them, social capital can help youth access basic needs, maybe someone to pick up groceries or sort of help, and really to endure the economic crisis that has hit. Youth jobs have really taken a hit. So someone to loan you money, or if your family member loses a job or can't pay rent, sort of having that connection and someone who could help through that is really important right now. So thinking about those 8 emerging practices I walked through, a few stand out as kind of potentially particularly relevant during COVID-19 and adaptable as we think about social distancing and sort of helping people connect over physical distances, but making sure that social connections aren't dropping. The first and sort of perhaps most obvious is the idea of using technology, right? Using social media or other technology to connect adolescents with each other over social media platforms, using text message groups for emotional support. You as an organization could even sort of tag or post links to other community organizations through which the adolescents you serve can access resources, like food or supplies. We can also think about how to take advantage of the technology that youth are already using and sort of digging into that, so that really helping them use that to build those and save those connections. We can also think about how to provide structured opportunities remotely. So, a structured chance for adolescents to connect distantly, maybe an online game night, a virtual mentoring session, sort of a socially distanced small gathering, sort of thinking about ways to provide those chances for folks to come together. We can also offer peer groups remotely, virtually or over the phone. Emotional support, I think for many of us, myself included, is more important now than ever. And so making sure that we're not missing out on that for our adolescents and helping them connect over shared experiences. We also, of course, want to, however, keep privacy and security concerns front and center as we're designing those pieces. And then also engaging qualified alumni to reach out to adolescents to sort of help them offer suggestions for those best ways to connect, for how to sort of get through this experience, maybe sharing their own experience, their own coping strategies. And alumni can also be helpful for you as you think about your program. They might have really good suggestions for sort of how to shift program activities, sort of how to connect with current participants in a way that might go a little bit beyond. They're just bringing a new lens that might be really helpful. Okay, next slide. So I'm just going to go through these very quickly and wrap up. I really want to get to a good discussion. And I see there's been some activity in the chat box, which is really great. So this link at the top, asc.hgs.gov/social capital. Everything I'm going to talk about is on that page. So if you just go to that URL, we'll have everything. But I did also include the individual URLs in case there's something you're particularly interested in. But this slide just walks through the resources for the piece that we talked about, the definition of social capital, some of that research base, and what we have from sort of bridging the academic literature on economic mobility and peer support, and then a bunch of pieces around measurement. And I love to talk measurement, so if anyone has questions, there's a brief, there's a webinar, we've got that logic model tool, we can get into it in the Q&A as well. Next slide. This is probably the go-to resource, though. It walks through those 5 underlying principles and 8 emerging practices I walk through. So there's a section on each of those practices individually. And then for each practice, there's also an editable worksheet that your team can use to sort of fill in stuff that makes sense for your particular population, for your program design, for your goals, and your participants to really understand and think about how that practice might apply and sort of might be adapted to improve outcomes even further in your own program. Next slide. And then we also have a couple of other pieces as well. So we've done some podcasts, which I would definitely encourage you to check out. Those podcasts are on specific practices, including the cohort models and using technology. And then we also have one on engaging participants and sort of using a couple of strategies there. We've done a brief specifically on serving the reentry or incarcerated population. And then we have a bunch of case studies on the website, including those two Teen Challenge Arizona and Roca that are sort of specifically targeted at youth or adolescents, but also a bunch of others that serve parents, many of whom are young, or sort of other populations that might overlap with the folks that you all are serving. Next slide. And then we are currently finishing up some work around peer supports, really specifically diving into justice-involved individuals and folks who have experience with domestic violence or human trafficking. So we're really trying to understand a little bit more there about what those peer supports look like when you have a sort of more traumatized population that might need a little bit more support. Okay, next slide, and I kind of want to open it up for Q&A and see what folks are thinking about.
Thank you, Amanda. And maybe let's ask Julie to go back to that slide that you had shown of things potentially during a pandemic. And one of the things that you talked about there is qualified alumni reaching out. In the context of the SRAE program, one person in the chat said that some of their alumni go out and teach their peers in their social groups. But any other comments from you, Amanda, as to really how particularly many of these programs are in school settings when the schools are open, but now they're in virtual settings. Any comments that could be helpful, how they could utilize that?
I think, especially as we transition to, at least hopefully for not terribly long, but as we're in sort of a virtual setting, I think sometimes alumni and adolescents themselves, or folks who are recently adolescents, might be a little bit better connected or bring a different perspective about what are some creative strategies we could use to engage adolescents to sort of help be supportive of them and their goals and help them keep moving on the progress and towards sort of the outcomes that we're hoping for them during this really difficult time. So this sometimes might bring different perspectives on how to adapt your programming, or sort of what to add, or what kind of framing might make sense, or what strategies, are there ways to use social media, or if folks, are adolescents really burnt out on screen time if they're in virtual school right now, or has the experience really helped them open up to new ways of using technology where we might be able to sort of think about how to adapt programs even further and do webinars and other types of strategies online in our own programming. I think those adolescents can bring good program design input, and they also can just be a friend and sort of be a resource to current program participants. I think it goes back to that idea of sort of what are the three types of peer supports: peer mentors, peer navigators, and peer support groups. And those peer mentors are just someone who's been through a similar experience and can kind of talk about that and sort of bring that to bear as someone who understands, maybe someone who's had some success. And a peer navigator would be someone who maybe has a little more training and kind of help them navigate how to access services and supports in your program, but also in the community more broadly. So they can be really helpful there. And there's a credibility if you've been through something before. It sort of brings the credibility in the eyes of participants. That if those of us who haven't gone through the program as participants may just not be able to sort of achieve that same level of credibility that an alumni might be able to.
Here's one. Teens seem to thrive on relationships already, mostly with their friends. What could facilitators and educators do to encourage teens to not ignore the adults around their friends, particularly as it relates to social capital building?
I think that's a great question. And I think sometimes that's where those mentoring strategies can come in, or where those bridging social capital connections can come in. And I think, we all, I think I'm guilty of this, and I think many of us are, that it's easier, and this is why peer support can be so useful, right? It's kind of easier to spend time with people who are like you, people who are your age, people who have been through similar experiences, people who have similar characteristics or demographics. And so that's why that can be such a valuable piece, but it's also why it's so important to make sure that we get outside of our bubbles and sort of understand people and experience and interact with folks who have different experiences and set up the opportunities for those conversations to happen. And so I think about some of the programs we talk to that have, dinners or regular meetings with folks who are coming from very different backgrounds. And really they just open up and try and build that connection and help. I think it's about helping young people see that you're not judging them and that you're trying to understand their experience and their perspective and that you value that. And in turn, then hoping that they then can understand that you bring a valuable perspective and sort of have different expertise and experience to offer, and really helping sort of each other connect. I think that's one thing that's really useful. More concretely, the ROCA program that I mentioned, the sort of relentless engagement, one of their specific strategies that they use is they try to figure out what the young person needs and to sort of deliver that and make sure that they're, particularly when people may have had others in their lives who've disappointed them and haven't come through all the time, especially adults in their lives who haven't always come through for them. Then if the young person is really struggling with accessing a certain service or trying to figure out how to navigate some process, just sort of committing that you will help them do that and really following through and helping them achieve their goals and getting them access to the resources or supports they need or whatever it is that they need, and really showing that you've sort of put them front and center. And I think ROCA's experience has been that when you sort of demonstrate that you're there for them and that you are trying to support them in meeting their own goals, then that kind of opens up the level of trust and can lead to those additional conversations and kind of engagement and that meaningful relationship building.
That makes me think, Amanda, of an experience that I had. Obviously, as parents, we love to talk to our kids' friends. And my daughter had a good friend, and she was able to talk to us as parents of our daughter. And when she wanted to look for a summer job, she asked me if I could help her out. And so I found her a summer job, an internship, which ended up turning into an entire career for her. So it just, as you were talking, it just reminded me of sometimes teens don't really know how to relate to the adults that are in their own circle. And your comments, I think, are helpful to people that run these kind of programs to think about referring and helping teens reach their goals. You also talked about accountability. One question would be, can you comment on how this idea in the context of SRAE can impact youth behavior? Because in the SRAE program, changing youth behavior is a critical key goal.
Yeah, so I think, so I've talked about accountability in two different ways, which I think are very different, but both really important. And I think it sort of goes back to the more that young people can feel empowered and like they're driving the process and that we're being responsive to their goals, then I think that sort of builds a level of trust and engagement that is more difficult to do otherwise. So one type of accountability is sort of structuring a relationship and thinking about sort of those explicit agreements that are written or verbal. And I think where it seems like those, from the programs we looked at, where it seems like those seem to be most helpful is when developing the agreement is sort of a two-way street. And it's kind of a process that's done jointly. So it's not that, a young person is presented with, here's the agreement, can you just sign it? it's a conversation starter, and it says, you know, here's one way our relationship or this might work out. What do you think? You know, how often do you think we should meet? How often, or what types of conversations, or what kind of work should be done in between services and sessions? Sort of using it as a conversation starter. And because when young people then, and I think this is true of many of us, of all of us actually, when we've sort of helped design the framework, we then feel more ownership over it. We feel more bought in automatically. And I think we feel accountable to ourselves and to the others that we've then sort of made this agreement with to make sure that we keep showing up and then we sort of keep working toward what our goals are. So I think that is where those agreements, those sort of written agreements or verbal agreements can be really helpful. And then I always just go back to those peer groups, kind of peer-to-peer support, because, I mean, program after program after program that we talked to said that what the participants value most about those peer groups is the accountability, and that it's someone who will call you out if you're not showing up for school, who, you know, in a good way, right, in a productive, I'm your friend and I don't want you to miss out, but I'm here to tell you you're not making progress. One of the programs we talked to would share examples of someone who was maybe trying to start their own business, or, you know, had set out some other goal and had sort of publicly stated to their peers this was their goal. And as month after month went on and they hadn't really made any progress toward that goal, the peers kind of, you know, asked them about that and said, well, what's the problem? Why aren't you making any progress? And when there were concrete challenges, I don't know how to fill out the paperwork, or I don't know what, you know, then people could problem solve jointly together and sort of bring in experts and resources to get them there. But when sometimes it's just we're scared of our own goals and we're not quite sure what to do and it feels overwhelming to take those first steps. If we sort of publicly stated what our goals are to our peers and they're kind of checking in and want to know what progress we're making, then we do kind of feel some accountability to ourselves and to our peers to at least try and make some progress on those goals. And so that level of self-accountability, I think, whether it's because you've been involved in writing a goal down or you've sort of explicitly stated your goal to your peers, I think that's something that we heard in a bunch of different programs was something that participants themselves really valued, and that seems to be pretty effective in helping people continue to make progress toward those goals. And I have seen a couple of questions about, just a quick tangent, about the Building Wealth and Health Network that's using TANF, and so that randomized control trial program I talked about. So that's out of Drexel University at the Center for Hunger-Free Communities, I believe is the name of the center. But it's out of Drexel University. If you just Google Building Wealth and Health Network, you'll see Mariana Chilton runs the program, and it's just, they've had there's some great publications on their website too, kind of a mix of academic journals and some nice, much more accessible briefs that are kind of easy to quickly digest some of the key findings, research findings. So definitely encourage folks to check that out.
Here's a question from Brandon, and maybe you just already talked about this a little bit, but basically saying most SRAE programs focus on interpersonal relationships and development. Are there programs that are evaluated that focus more on environmental or institutional level development in terms of impacting youth development?
That is a great question, and I'm sure the answer is yes. I'm trying to think of something off the top of my head of specific programs. Mm-hmm. I do think the CDC has some research showing the value of community level relationships for youth. I can see if anyone, I think my email was on the last slide. If someone wants to email me, I can follow up with that and just try and dig up that CDC research and the specifics. But I think, right, it does go back to that point that community level, organizational level, and individual level social capital are connected. And it stands to reason that in a community where there's stronger community level social capital, stronger faith-based networks, stronger nonprofit capacity, more voter engagement, sort of just more community engagement, that it's easier, and there's sort of already an underlying sense of connectedness that makes it easier for individuals, young people, to build their own social capital and their own relationships with linking with institutions in the community of power, bonding and bridging social capital with sort of others there, because there's already that kind of base there. And there can be more challenging communities where that community level social capital doesn't exist. does not mean it's impossible, but I think those things can really reinforce each other. So we also need to think, as we're designing programs and data and measurement and evaluation strategies, what's the context that we're doing that in? Because all of your communities look very different, and so really taking that into account and understanding sort of how that plays out and thinking through what the opportunities are, what the challenges are in your own community, I think is really important. It's not an easy thing, one size fits all, unfortunately. You've got to use your own expertise, sort of your knowledge of these programs, of the young people you're serving, of their needs and what sort of resources are in the community to try and pull it all together and see what we can do to help young people.
Thank you, Amanda. And you can see there on the screen Amanda's email if you would like to get in touch with her. And she has several colleagues listed there that she works closely with as well. So thank you very much. And we are grateful that you took the time to share this with us.
Thank you so much for having me. Look forward.
Let me close out this time by, first of all, asking you to be sure to fill out the evaluation forms on each of the sessions. But this session is now going to go directly into the field talk session. And I'm going to introduce the persons that will lead that session, and then we can just move right into it. Ramona Ellison has served as the founder and executive director of Little Rock Skills, which works to battle social ills one child at a time. And the organization teaches character development to preschool, elementary school children, and middle and high school students, equipping them to make healthy choices through the SRA curricula, Choosing to Excel. And then Melissa Walther is the National Project Director for Ascend. She's been in the field 14 years, working to help youth achieve optimal health. She began her career as a sex education health facilitator, working directly with thousands of youth. So welcome Ramona and Melissa, and they will give you direction in this field talk.
Thank you so much, Jerry. And thank you, Amanda. That was such great information. And I am really excited to hear back after all these great discussions, because based on that original poll, this idea of social capital maybe seemed a little bit foreign or new, but in reality, I think when we heard all of the ways that that can be accomplished from Amanda, it highlights all the ways that you're already doing a lot of that work. And the SRA is sort of built around the value of relationships. And so this is really exciting. I can't wait to hear how you guys kind of digest and share the information and how your programs are already kind of using some of those tools to build social capital in youth. So this will work very similarly to how we've done these field talks for the past 2 days. So hopefully you've been able to join us and you're familiar with this, but this is really kind of designed to be a time of conversation amongst all of you as grantees, to share ideas, maybe even share challenges, but specifically to respond to a couple of questions. And so we'll send you into these breakout rooms in small groups, and you'll have a little bit of time there to share responses to 2 specific questions. And those questions are, the first is, what social networking are you using or have you used to build social capital with youth? And so again, I might suggest that you just take out your phone and snap a picture of that question to kind of have it to reference while you're talking in your small groups. It will be broadcast into your breakout room also, but that'll just kind of help remind you and keep you on track on what you're discussing. You'll have a little bit of time to answer that question, and then we'll move on to the second question, which will also be broadcast into your room. And that question is, what did you learn about social capital research that can be applied and implemented to increase your program's effectiveness? So, like I said, I think Amanda even touched on a few of these strategies that are already integrated and used widely in the SRAE field. And so we'll be excited to hear what you share with one another there. And then when we come back from our breakout rooms, Ramona Ellison will help kind of facilitate conversation. And to help her do that, you'll need to identify a spokesperson in your breakout room that can share key takeaways and kind of a summary of what you talk about. So get ready, flip those cameras on if you're at all able to in those breakout rooms to facilitate good interaction and conversation. And you'll get sent here to a breakout room to start your conversation. Make sure you introduce yourselves and where you're from when you share any of your suggestions and strategies. We look forward to seeing you all soon. We can't wait to get a little taste of what you got to talk about. So I'm going to hand it over to Ramona Ellison. She's here to help facilitate this conversation and share out time. Thanks, Mona.
Good afternoon. I know you guys probably just did not have enough time in that, right? 20 more minutes. It's never enough time when we get to kick around our thoughts and ideas and discuss what's happening in the field. And so this is now your opportunity for everybody to hear from each other. So if you were selected as the spokesperson, if you volunteered or were voluntold to be the spokesperson, if you would go ahead and use the raise your hand icon, so we'll know who's going to be speaking on behalf of your group. That would be awesome. Emily, I see you. I see Deanne. I see Ramonda. If there's any more who are supposed to be the spokesperson for your group, if you'd go ahead and use that feature, and we'll get ready to start sharing. Okay, I'm going to remind you of what the questions were. And when I call on you, if you would just go ahead and unmute yourself and share on behalf of your group. The first question was, what social networking are you using or have seen used to build social capital with you? The second question, what did you learn about social capital research that can be applied and implemented to increase your program's effectiveness? Deanne, let's go ahead and start with you.
Hi everybody. I'm Deanna Rowe. I'm from Pima Prevention Partnership in Tucson, Arizona. And there was only two other participants in our group. One was Libby Kutch from Michigan Public Health Institute, and Tasha Adams from Raleigh, North Carolina, and she is with Youth Empower. And I will admit, we spent a lot of our time just really kind of getting to know each other and talk a little bit about our programs. But when we did talk about the social kind of media platforms that we worked with, most everyone said the common ones. Libby talked about, she is an evaluator with that particular group. So she talked a little bit more about that they use Facebook. They've done some TikTok and so forth. And Natasha said the same things, but they have started a social media committee. So they're starting to look at actually trying to use more platforms. And we at PPP, we do some of those same common ones, but the We Think Twice campaign has really been a huge platform. We consider social media that our program has really been using just to interact with their peers and to really get them on board. So that was what we kind of learned from that question. And then flip it over here. I wrote so much. The second question, when we talked about the research, we weren't quite as clear on what the research piece meant, but we talked about each of the kind of use of what social capital is. And I think Tasha and I got to talking about that. They have an ambassador youth program, and we have a peer leader program that we started way back in the like 2000, and it's continued. And they're not only a social capital, but a human capital piece. And we really talked about how we've leveraged their relationships and them using the community and the work that they do out in the community. That's really kind of like, really emphasize the programs that we do and how we can play it kind of forward with them. So that was most of the things we talked about. Her youth ambassador program meets on Saturdays once a month. Ours is more of a summer type of program. So that was pretty much where we got when we talked about that. And I guess I shouldn't say that. The last thing that we did talk about was, our collaborating partners, the schools that we use, the community partners. Tosh talked a lot about the fact that with not being able to go into schools, how they've had to build a lot of relationships in the community to do the program. So I think everyone's probably had to do that, but it was a great conversation and I really enjoyed having that time with them. So thank you all.
Oh, good. Thank you, Deanne. Thank you. Let's go to Ramonda.
Hi, Miss Ramona. How are you today?
Good.
Good. So our group, we had about 5 or 6 people from all over the United States, from Ohio, Florida, DC area. Yeah, so we were like, and then I'm in Arkansas. If I'm leaving somebody out, I'm so sorry. So we had everybody from like all over the United States. And as far as using the social media, our friend just right before who was on there, she basically said a lot of the same things that we said. We use Facebook, Instagram, trying to, reach the community or whatnot. For the second question, we did incorporate talking about We Think Twice. And one of our members, she was talking about, or she had posted that they use Nearpod, which I think is like really great. I have never heard of Nearpod. Not actually screenshotted it so I can write this stuff down. Oh, West Virginia was the other place. But she uses Nearpod. They use Mentimeter. I've never heard of that. And they also use Kahoot. And so that they can be inclusive, their organization is developing an app so that LGBTQ could feel like welcomed into the conversation as well, which I think is a great thing so that everybody can feel okay to receive the information that we talk about. But for the most part, we had another individual. She is basically teaching virtual right now. So she's like, they're in schools or they do churches, but they have to do virtual just, I guess, because of everything that's going on. But for the most part, everybody was on the same mindset of using Facebook and things like Nearpod and stuff like that. So yeah, that's what we talked about in our group.
Great. And it looks like someone has already put that in the chat. That's really helpful for those of you who are sharing. If you're in the group with that person, if you just want to go ahead and put some of those resources in the chat, that can be useful to someone else a little later. All right. Thank you so much, Ramonda. Let's go to Mary Green.
So I won't duplicate what some others had shared. We as well were thankful for the Think Twice campaign. That has been a very helpful resource for us. Some of us talked about the curriculum that we use, and a couple of us use the Teen Outreach Program, and a big portion of that is service learning. And that is really where we connect our young people to different opportunities that they value, that they want to get involved in. And so they are creating partnerships with law enforcement, with Meals on Wheels, with the Rescue League. They have opportunities if we're talking to news stations. So building those relationships within the community, it's good for the young people, but it's really great for the adults too, right? So they're seeing these young people as valued assets of their community. So that has been a great way, I think, for some of us to do some social networking. The other thing is it's a 9-month model. So that alone, they're creating these really trusting relationships with their facilitators. So they are reaching out and having some more trusted adults that can be a part of their lives. Let me see, I'm just checking if there's anything I kind of missed. I don't think really I should touch on anything else because it's what Ori, Deanne, and the other young lady had talked about.
All right, thank you so much. Thank you. How about Emily?
Hi, y'all. I'm Emily Rivera. I work for Nebraska Department of Health and Human Services in Nebraska. So my group's conversation was very similar to Mary's group's conversation. We all implement the Teen Outreach Program. So for question number 1, we were able to discuss how social capital is really built into our programming. We talked about the community service learning component. We also talked about being able to make those meaningful relationships in our cohorts because it is a 9-month implementation program. We also talked about, for the second question, we started talking about how important we see alumni being that piece to be able to be incorporated into our programming. We've all had instances where we've had teens who actually completed the teen outreach program and then they went on to become facilitators. And so we were really able to see how important it is that they had that unique experience and were able to relate to the teens. And really, we were able to see how the skills they were able to build within being teens in the teen outreach program were able to then make them be really great facilitators.
Awesome. Thank you, Emily. April?
Good afternoon, everybody. I am April Love. I'm 28 years in, educator, and I'm in North Carolina. And so I self-selected because we were all muted. And we had a great conversation about the social capital and the idea that a lot of the people on with us were in schools. And so that alone has its own groups and its own kind of peer groups. And also for our program, we work a lot with churches and communities, which automatically has the students being the participants being the recruiters. And so just looking at the social capital of them being their own recruiters and getting people to come along. The names of the groups that we were in were awesome. Somebody's group is called Plan B, like what you plan to be. Love that. And somebody else has, correct me if I'm wrong, it was Chips in the gang, and it was talking about chosen to be the heirs and making intentionally pure choices. So loving all of that. And we just talked, about Facebook and some different things. And I just like to point out that even though the young people don't use Facebook, because with ours, we need permission for 13 to 17, we use Facebook to make sure the parents are informed.
Nice.
And we give incentives like gift cards and also $5 gift cards, which gets the young people kind of to be ambassadors. And the ones who do a nice job sharing and have some good insight, we invite them to be ambassadors or even just let us use their quotes on any of the campaigns.
That's awesome. That is awesome. I thank you so much for sharing. Are there any other groups that we still need to hear from? I think we are good. Y'all, thank you so much for sharing within your groups and sharing here as well. It's so awesome to hear what everyone is doing out there in the field and how you are being impacted with social capital as it relates to interacting with your kids and your youth in your community. Melissa?
Thanks. That's fun to hear all these specific ways that you're applying that social capital research. So the exciting thing about the work that you're doing is you may have already been using a lot of those, as was evident from the things you shared now, but maybe didn't have or didn't speak about it with the language that it's backed by research. And so we hope that some of the information that Amanda shared could be helpful in the way you talk about your programming, especially to maybe stakeholders in the community. And then secondly, encouraging ways to be intentional to really seek out how you can emphasize those areas that really strengthen the social networking and social capital for youth and for their communities. So, okay, we have a little bit of time here, so I'm going to ask again that that you fill out your feedback forms. I don't know if those will be shared right now or after our closing remarks session. You're going to have a short break after this before we go into our next session. Oh, there we go. Thanks, Julie. So there is a link.
Julie was going to put it in the chat.
Gotcha. So I see that. So yeah, we value your feedback and responses to the information that was shared. And I think I see that Amanda is still on. So does anyone have any follow-up questions after your conversations in the small groups that you'd like to ask while you have the opportunity?
Yes, thank you, Melissa, and thank you, Ramona, for leading this session, and thank you for all of you that took part in it and participated. I think, as Amanda said, and as several of you have said, this may be a little bit of a new term for you, but clearly building healthy relationships is something that is going to serve teens both in their circle of friends, in their relationships, in their romantic interests, et cetera. But it's also a workforce kind of training for the future. And I know a lot of your programs talk about the future for these kids. So anyway, I think this has been a good session to joggle our brains and think how we're doing this and how we're using this. And maybe you will look into some of the research that Amanda pointed out, and it will help you do some improvements and some enhancements in your own program. So the feedback survey should be in the chat box. So please go in and fill that out. And then we'll have a short break until the final session. And since the final session will bring track 1 and track 2 together, it's really not possible to kind of speed it up. So I hope you'll hang in there with us over this break and hear the closing remarks from FISB leadership as well as Public Strategies leadership. So we will see you there. Thank you.